Good morning. My name is Stacia Schwartz and I'm an ER nurse for Palomar Medical Center. I would like to thank you all for attending today. I would like to present to you my strategic plan to improve nurse-patient communication in the emergency room. With the increased demands placed on a nurse in a busy emergency department, excellent communication between nurses and patients sometimes takes a back seat. Patient satisfaction scores have suffered as a result. I have put together a strategic plan to improve communication between nurses and their patients. More specifically, my strategic goal is nurse-patient communication will improve as evidenced by a 10% improvement in patient satisfaction scores as of April 2017. Strategic planning is extremely important when an organization is to undergo a change for improvement. A strategic plan is a blueprint that defines organizational activities and resource allocations. Using this plan, we can turn organizational goals into realities. In order to identify Palomar Medical Center's internal strengths and weaknesses and external opportunities and threats, I formulated a SWOT analysis, S-W-O-T, SWOT analysis. This included a careful assessment of both internal and external factors that influences our company's ability to compete and serve the community. I have identified some of the factors that may help us to understand what our company is up against that may affect my strategy to improve nurse-patient communication. First, I will share some of the internal strengths that I have identified. We are a small rural community hospital that is embedded in a close-knit community. We have an incredible staff of experienced nurses that are highly motivated and willing to improve communication with their patients. The hospital is committed to meet patients' needs. We offer translation and interpretation phones and sign language professionals to assist with language barriers. There are some internal weaknesses that I've identified that may hinder our efforts. The hospital is frequently understaffed. There's a high incidence of sick calls and medical leave among nurses. Nurses often feel their heavy workload impedes their attempts to improve communication with their patients. Additionally, patients are often reluctant to clarify discharge instructions due to a language barrier. Sometimes they're even embarrassed. I have identified external opportunities that the organization can take advantage of. The hospital has an excellent relationship with high-profile organizations such as Mayo Clinic and Kaiser Permanente. This could lead to collaboration to improve nurse-patient communication. Palomar runs daily language census reports. Continued use of these reports can increase awareness among staff of specific patient communication needs. Additionally, the hospital should purchase additional language interpretation phones to ensure that there are options available to staff when an interpreter is not available. External threats have also been considered. Funding may be limited to support this project. Nurses may not feel supported when demand of their time increases to address the communication struggles between nurses and patients. Additionally, the perception of the community may be that the staff is unprepared or unwilling to improve communication with them. After the SWOT analysis was completed, I developed a strategy map. A strategy map is a visual aid that shows how specific goals and plans in each area are related to each other. It provides an excellent way for managers to see the cause and effect relationships among goals and plans. This map includes identifying goals for financial performance, customer service, internal business processes, and learning and growth. Ultimately, these goals are identified in order to achieve Palomar Health's mission, which is to heal, comfort, and promote health in the communities that we serve. An important step when developing a strategic plan is conducting a stakeholder analysis. This is the process of identifying the various stakeholders that are affected by the organization's actions. It identifies the needs, expectations, importance, and power of the various stakeholders and how they may each relate to the project. I have identified many stakeholders, including but not limited to the hospital CEO, nursing leadership, administration, current nurses working for Palomar Health, patients, financial donors, the community, and others. Next, I put together an action plan. When formulating functional level strategy for primary business functions, managers use action plans to turn an abstract goal into an attainable reality. This helps to provide a future vision for the organization and facilitates collaboration with stakeholders, departments, and business functions. A manager who makes strong decisions will support positive, measurable growth of an organization. After identifying the various stakeholders, I have developed specific management strategies and tactics for each to achieve our goal. First, for the patients in the community, we will utilize innovation to develop new, effective ways to allow patients to become more involved in the process of planning for their care. There are benefits to decentralizing planning by involving planning experts to find new ways to develop new goals and plans. This will assist with giving staff new opportunities and ways to communicate with patients regarding their health care. For nursing and supportive staff, we will set goals and involve staff to determine what the organization is trying to accomplish. This will help to define the course of action to achieve our predetermined goal, followed by a process review. Management will do this periodically to ensure the project is on track. Finally, an evaluation of overall performance should be performed to determine whether the project has been a success or a failure. We will involve upper management by developing a contingency plan, and this can assist with defining how the organization will respond to setbacks, unexpected conditions, or emergencies. This will allow the organization to respond to the crisis with a plan ready to carry out. Financial donors will be involved utilizing building scenarios, which will be useful to prepare for an unpredictable financial future. Keeping up with current opportunities and trends may offset a certain amount of financial threats that are difficult to foresee. This helps when asking what if when analyzing patterns and scenario building. Learning and development will be involved in order to provide guidelines to employees that adhere to the policies and the procedures of the organization. Training programs will be developed and provided to the employees to improve communication. Human resources will be involved in the review process and the appraisal of overall performance of nurses. This will focus on the efforts of managers and employees. After the decision is made to implement my strategy plan, management will share the new strategy with employees. It will provide a guide and shares the organization's specific goals. Management will stay in contact with employees to ensure open communication and eventual collaboration resulting in success of the project. Management styles and tactics are important when motivating employees. When implementing the plan, it will be imperative that management provides a platform for open-ended communication. Monthly meetings will enable the managers and employees to evaluate the success of the launch of the plan. This will ensure that all players are on the same page and understand short and long-term goals. Management should make sure communication is a top priority. This will allow for sharing of clear objectives, encouraging relationships between employees, different business functions, and management will make collaboration an easier process. It is imperative that management projects confidence in the project and encourages feedback and suggestions from staff and all stakeholders. Keeping people involved at every level will allow them to take ownership of their part of the process. I have devised specific strategies and communication channels for patients in the community, nursing and supportive staff, management, and financial donors. A leader should recognize the importance of distributing important information using a communication plan. To communicate with patients in the community, we will take the initiative to allow patients to play an active role in the organization, the community, and their own health care. We will host local events, health events focusing on forming and nurturing relationships with potential patients in the surrounding area. We will promote a connection between nurses and patients this way. To communicate with nursing and supportive staff, we will offer continued education for nurses to improve their communication skills. We will ensure that there are several modes of learning available, such as online, classroom, and self-paced learning. We will communicate to staff the importance of improving communication between nurses and patients. We will communicate with upper management with frequent updates of the status of the project, and we will continue to ensure upper management is aware of the importance of improving nurse-patient communication and how this improvement will strengthen the organization. Leadership skills will be used by managers to play the role of cheerleaders to encourage, inspire, and motivate all stakeholders involved. All participants should understand their roles and their functions within the plan. Finally, I have identified an evaluation plan to determine whether the strategy is working. One important step to ensure the plan connected the mission to the vision, we will use a feedback control model. This model allows managers to monitor and regulate an organization's activities. It uses feedback to determine whether goals are being met according to established standards. And because the strategic goal is to be measured by surveys sent to patients, the performance can be easily measured. A control system will be set up to include establishing standards, measuring performance, comparing performance to standards, and to make corrections as necessary. Managers will monitor real-time data so that corrective action can take place as soon as possible. Comparing performance to standards determines whether the organization is meeting, exceeding, or falling short of standards. In summary, to ensure the success of this strategic plan, I have created the SWOT analysis, a strategy map, a stakeholder analysis, an action plan, a communication plan, and have identified an evaluation plan. I hope that you will consider the importance of improving communication between nurses and patients. Not only will patient satisfaction scores increase, but our hospital's relationship with the community will improve. Thank you again for attending this presentation, and at this time I'd like to provide the opportunity for you to ask questions. Thank you.